Honourable Julie Bishop, representative of the New Zealand High Commission, Mr. Llewellyn Robert, representative of the British High Commission, Mr. Tony Brennan. There's Tony, thank you. And distinguished guests, ladies and gentlemen, and very, very particularly all of the staff who served in the Ebola treatment units in Northwest Africa. And to all of you, thank you very, very much. And this ceremony is definitely dedicated to you. Aspen Medical's mission is to provide world-class healthcare wherever it is needed, particularly in locations that are remote, challenging or under-resourced. And Sierra Leone, in the time that we went there from November through to last month, was all of those. Our core values are the pursuit of excellence, integrity, respect, teamwork and compassion. And if any one project encapsulated all of this, it was the Ebola response effort in Sierra Leone that was activated by the Australian government. When the Prime Minister announced on the 5th of November 2014 that Australia would be increasing its efforts in West Africa, we were immediately inundated with applications from courageous, compassionate and dedicated health professionals. The applications totalled over 1,200 people. Within days, our team were on the ground in Sierra Leone working hand in hand with the British government, the governments of Sierra Leone and a range of non-government organisations who were already in place in an environment that has been described by one of the members of the first deployed team, Dr. John Gerard, who joins us today, as the worst affected city in the worst affected country in the worst ever epidemic of the most lethal communicable disease ever known. And I should point out, John is not prone to overstatement, so no small thing that he would say that. We knew Australia and the world wanted to ensure that we selected the best of the best to lead the fight against Ebola in Sierra Leone. We believe that this is exactly who was deployed. We threw an enormous amount against this team in training. We showed them the security situation. We showed them what it was like in the towns. We showed them what it was going to be like when people did die from this disease. We even brought in solicitors to explain that if they didn't have a will, they needed to have it in place before they left. They were heading to the epicentre of an outbreak where 20% of all health professionals had been infected with a disease that would kill every other one of them. They all knew this and they still went. We employed in excess of 250 African staff in support of this mission. We worked to ensure that they were paid fairly, that they were paid on time, and that they were all trained to the highest possible standard and above all, treated with the respect they deserve. Many of them had family and friends who were ill or who had died from Ebola, and we knew that for them, this was personal. We wanted to ensure that not only every Australian and New Zealander who committed to this came home, but that every single African who worked with us went home safely as well. Our team worked together to ensure that everybody who survived Ebola and all of those who also presented to us with other diseases that would typically kill in Africa survived. Nobody was turned away. Of those survivors, some as young as 4 years old are represented on the wall of hope that we have here. Every one of those hand marks not only represents a survivor, but they represent hundreds of other possible infections that were stopped and consequently the saving of hundreds of lives. We are currently in negotiation with a number of museums in Australia about displaying this wall as a national asset because we believe this wall doesn't belong to Aspen, it belongs to the commitment and dedication of every Australian involved. We should all point out that also with all of the work that was done, there was not one single infection in any single Aspen personnel, either Australia, New Zealand or African, who was deployed. I think it's amazing to think that countries furthest away from the outbreak, with no strategic interest in Africa, no colonial past, could be the ones to have achieved this wonderful outcome. Australia's project management, combined with Australian and Kiwi health professionals, set the benchmark for delivery. We worked so closely with the groups already there. We combined our knowledge and we exported it and our expertise to ensure that lives were saved. In addition to the lives that have been saved, our legacy from this mission has been to leave behind in Africa a highly trained team of local healthcare professionals who will be the first line of defence in Africa for any future outbreaks of Ebola or any other disease. We now also have a highly skilled cadre of health professionals in Australia and New Zealand who can provide support across the entire Pacific region for any future outbreak, and there will be an outbreak. I want to thank also all of the Aspen Medical team in Canberra who supported the response effort. I also want to thank them for the time they gave, the hours they worked, the dedication they did. I want to thank all of the members of the Australian government, particularly those in DFAT and the Ebola Task Force within the Australian government, to the New Zealand Ministry of Health and the UK government. What we did, what we all did, everybody here and in locations around the world to deliver that effort was extraordinary. We should all be incredibly proud of what has been delivered, and we so look forward to celebrating and commemorating that with you tonight.